Welcome to the Ovation Show, where we're discussing the healthcare crisis in America. We're bringing partners, colleagues, clients, and business owners together to discuss solutions and innovations that are bringing a higher quality of care to employees while reducing their out-of-pocket costs. We're also reducing the employer costs and giving them more transparency and control. Today, we're live in the Work Innovators studio, where Work Innovators is amplifying the voice of business. Today, we're going to discuss innovation in the healthcare space around spine and joint health. And with that, I bring in Scott LaRoque. He is the CEO and founder of MPOWERHealth. Thanks for coming in, Scott.
Dan, thanks for having me.
I said LaRoque. Is it LaRoque or LaRoque?
LaRoque.
Okay, I did say it right first time.
Absolutely.
Awesome. Thanks for driving up from Austin.
Yeah, absolutely. Happy to be here.
So tell me a little bit about you, because I know you went to University of Texas, degree in biology. Kind of tell a little about.
Yeah, so I grew up, my mom was a nurse, my father was a pharmacist, and so I grew up in and around healthcare. Was lucky enough to attend the University of Texas and really had a focus and a passion for healthcare and people, helping people improve their condition.
So when you got your degree in biology, what did you really think you wanted to do? Was there a direction?
I thought I wanted to be a physician. I ended up going down a path of doing drug discovery and working in research and genetics. And that pathway was extremely interesting. It taught me about how to do research and how to push the frontiers of medicine forward. But where that pathway fell short was I was interacting in a lab and not directly with people. So my transition from there was doing research in and around the nervous system, identifying different devices that could change change body output, change body physiology. And so some of the areas that did initial research on were spinal cord stimulators, artificial cochlear ear implants, retinal implants. And that pathway led me to do research in deep brain stimulation, which is a treatment for Parkinson's disease. People would develop tremors or movement disorders, and there was a way to use electricity to change how that functioned in the brain. That introduced me to a new career field called neurophysiology, and neurophysiology was very new at the beginning of this century. Ended up learning that craft and expanding across the country in that field. And we now cover about 50,000 surgical procedures in the operating room, have at least one person in the operating room, and over 50,000 surgical procedures today.
So that started you, I guess, going in that path of neurophysiology and so on, brought you to create MPOWERHealth.
Right.
And back in, I think, 2009, roughly?
Correct. Yeah.
Okay. So briefly describe what is MPOWERHealth. Because when I met Jessica, she described it, and it was like, this fits perfectly in the next-gen benefit strategies and the self-employed, or the self-insured employers that we're dealing with. So talk a little bit about MPOWERHealth and what you guys do.
So MPOWERHealth has really been a company that's focused on identifying where there is friction in the marketplace and helping to solve that. So our first place in doing that was bringing quality to the operating room and bringing structured data to the operating room. And from there, we really looked on how we can expand upon that data-centric approach more pre-operatively and post-operatively within that care paradigm, and then also using that data to help create more predictability around pricing.
So predictability and pricing, you're more of a data center and connecting all the pieces. You're not actually the provider doing the surgeries, doing this.
So we actually provide some of the care in the operating room, but we've used that data structure and our relationships with all of the different care providers in a given surgery or in the entire musculoskeletal continuum to bring those groups in and to structure them as members of the network. And then using a framework of technology to make sure that we're treating the right patients in the right setting and treating the right condition at that right time.
So you have a network, and then you really focus on that joint spine because that's just where your kind of passion was, and that's where it felt. Because we do know that I know there's other services that provide those, but they could be all different types of surgeries, where we're using one right now for a gallbladder surgery. Yeah. But you focus primarily on the spine and joint.
We really have focused in MSK. We have deep-seated relationships. We have a lot of structured quality data around the physicians, not only in our network, but outside of our network. So we're able to benchmark and understand the quality of the doctors that we're recruiting into the network. But I think MSK has been a point in time an acute care delivery service, and we're really looking to structure that to take care of bone and joint health, and to use two concepts of virtual clinic and care management technologies to help create a better patient experience, to give patients better access to care in their homes, and to reduce the overall cost structure of caring for those patients. So by putting together virtual care with care management and the ability to refer those patients downstream to known high-quality providers, allows us to impact the cost curve early on in the model by reducing the number of patients that go to surgery. And when surgeries are needed in a certain percentage of the population, we're able to provide predictable pricing through that sleeve as well, by creating using the data that we have to project a proactive pricing methodology.
So you hit on two really important keys that we talk about all the time in the next gen strategies that we do, is pricing, transparency, control, and really reasonable pricing.
Yeah.
And then the quality of care. So let's go back. Let's focus on pricing to start with. First, we see 300, 400% Medicare. We see networks charging a lot. We see out of network. We were talking about it earlier. Somebody charging, $54,000 for a $15,000 procedure.
Right.
How do you control pricing? How do you base your pricing?
So we've enrolled physicians, and knowing where their contracts and what they're doing work for today has helped us frame a benchmark rate that we incentivize the physician with an amount that is better than a commercial rate, but maybe not as high as what you're experiencing. Because we're contracting with independent providers, we feel like we're not only achieving the best quality through that physician mix, but we're also pairing up with some of the lowest cost providers in the marketplace, because they aren't tied through large health systems or through aggregated aggressive contractual negotiations. We're actually creating a team of low-cost providers that are willing to put their pricing out there in advance. And we're able to use data analytics to compile the surgeon, the operating room or the facility, the anesthesiologist, the neuromonitoring, the physician assistant, and any downstream physical therapy into a single price, where those providers are each joining together to take on the risk of that prospective price bundle.
I love that. That's what we saw with Oklahoma Surgery Center was one of the first ones to do that bundle pricing. In fact, we just did that the other day with somebody with gallbladder surgery. We look it up. We know that, hey, the cost is $7,500 all in.
Yeah.
And being able to have that predictability and transparency is fantastic. So talk a little about the network. So I think on your website you say, or in LinkedIn, it talks about 400 plus physicians in the network. How do you find those physicians? I mean, you mentioned the quality of care. One of the things I think about, and we'll get into quality of care, is you said, lower cost physicians and providers.
Yeah.
And a lot of times we think, well, lower cost means lower quality. So talk a little bit about the network, how you create it, how you find them, and then how do you really rate the quality of those providers?
Sure. So in finding the network, I think our business has grown organically by providing great service in the operating room. And we form partnerships with these physicians through supporting them in the operating room, and we become a trusted member of their team. And I think through that partnership, we continue to be nimble, proactive, and bring solutions to those providers that enable them to advance into the next stage of healthcare. So the clinically integrated network helps them with contracting strategies. It helps them engage in value-based structures and creates a feedback loop of collecting data on a care plan, understanding how that impacts that patient population, and then being able to revise that care plan to optimize the care over that population. So it's the overall feedback loop, the ability to collect data in real time and circulate that back and provide patient-reported outcomes back to the physician so that they understand how to improve that care over time.
Are you integrating anything like Quantros or anything in your scoring as well?
We do have Quantros as a component of our scoring system. We also have de novo categories that we're able to collect from the operating room that speak to objective measurements on surgical skill. And then beyond that, collecting our own outcomes and patient-reported outcomes data, and all of that comes together to give us a very robust picture of partners that we're willing to take risk with.
So I know that, you guys talk about, you have the physicians, 300 facilities in 24 states, and you said already said that, you've helped over 55,000 patients, which is fantastic. Talk about the process. So if let's just say I'm an employer or a broker consultant, and we're looking at, again, cost controls and transparency and working with our employees, how do we go about implementing Empower? Let's talk about first the implementation, then what happens afterwards.
Sure. So an employer is able to engage Empower to both run a virtual clinic overlay as well as a care management program. And those two things become the intake and ingestion point for patients into our system. We very quickly get them to our virtual clinic, which is an intake and triage and helps point that patient in the right direction for their care plan. So not all patients need to go straight to a surgeon, but in certain situations, there should be a fast track to get there. But there should also be a pathway toward getting to home exercise if necessary, and there should be a pathway to treating pain. There should also be a pathway to treating disease states, which may be osteoporosis or diabetes. I think an interesting statistic, out of patients that have had either a hip or a knee surgery, 60% of those patients have one chronic condition, and 33% of those patients have two chronic conditions. So these things seem to run in packs, and if we're treating one, we end up coming across some of those other categories at the same time.
I like when you talk about that total care management. So we use other things. We use Zero Card to get surgery pricing. They don't really look at the quality, but it's just a pricing negotiated network. I know for my own, when I had my knee surgery a little over a year ago, I used Hinge Health for my physical therapy, which was fantastic. But it sounds like you have all those pieces under one roof, basically.
We do. And the medical neighborhood, you had asked earlier about how we built that network, and it was through relationships and through word of mouth referrals and growing that business. But it's also an inclusive network that's meant to support the independent practitioners. We believe that the independents provide the greatest value in the marketplace. They go to the lower cost facilities because those haven't been aggregated and negotiated at scale against the marketplace. So, independent ASCs partnered with independent practices, partnered with many of the independent ancillary services along the way, and then backstopped against quality, provide us the ability to pass along great value to the end user, to employers, brokers, and TPAs.
So if we introduce it to one of our clients, which we're talking about now, we bring it into our client, they are going to how does the employee get to you? How does that build out on the inside?
So the employer stands up a program where they are encouraging their team to start their orthopedic care journey with us. It's a simple scanning of a QR code. You can enroll online. You can call a scheduling number, but that creates a very easy de facto upfront virtual meeting in the first 24 hours. So very quick connectivity to a care provider, and then we're able to understand what those issues are and point them on one of 5 different tracks. Those 5 different tracks, I think, end up shifting the cost curve continuum and end up reducing the amount of unnecessary high expense diagnostics that are done in certain injuries.
Okay. And then, so once the employee engages you, you guys handle that whole care process, walk them through and take care of those pieces. Typically then, from a billing perspective, let's just say I decide I'm going to go and get, I don't know, we were talking about earlier, the rhizotomy, have on my spine, $15,000. Do you bill the employer for this? Does it run through the insurance? So how does that work?
So this becomes a carve out within the health plan. So this is billed direct to the employer. And I think part of the savings here is removing the administrative costs out of what we are providing. So pulling some of those admin costs out, being able to directly connect with the employer provides part of the savings. And the other part of that savings is the alignment to the right facilities, the right care providers. And those two things can add up to really significant cost savings, up to 40% in a surgical episode.
I think we always talk about the right care at the right price at the right time.
Right.
And so that you're definitely hitting on that. I think that cost savings comes in big because we always, in these kind of programs, how do we get the employee to engage? Mm-hmm. And when an employer is saving 40%, they can look at the employee and say, hey, if you call in and decide to use this service, we can waive your deductible. We can waive your out-of-pocket for that procedure because, again, the employer is saving 40%.
Absolutely. Yeah, so there becomes, a real meaningful carrot that can be used through the employer. But the other part of that is real patient engagement and convenience for the patient. So once we get them engaged, I think we are reaching out to them when it's convenient for the patient to check up and make sure that care plan is being followed. And the real opportunities, even downstream of that surgical event, are how we reduce ER visits, how we reduce readmissions, and those things, we see on the back end of orthopedic procedures, concerns around infection and issues with pain control. And those really require access. A lot of orthopedic practices today don't have the ability for around-the-clock support. So if you call in at 5:15, you're directed via a voicemail to call either either visit an ER or call a teledoc service. We feel like this offering really is an extension of the practices. It creates a medical center home around musculoskeletal and helps point patients on a more proactive population health track as opposed to a very specific acute track that is high cost in most scenarios.
Well, I like the controlling and the proactive side because we know musculoskeletal, not only is it expensive, but typically if it's not done well and you don't have that constant care, it just happens over and over and over. Yeah, I mean, I know for a fact we've got plans where people are same procedures over and over again with no better results.
Sure.
Time. So having that, I think you sound like you're a true partner with not only the employer, but really the employee, make sure they get the proper care.
Yes. And bringing wellness online later this year, I think diet, exercise, and flexibility really sit at the core of most orthopedic problems. We've solved have made major strides with heart disease. We've made major strides with cancer. And so our patient population is aging. They're living longer, but our bone and joint health is not extending. Our bones last a certain amount of time. And if we don't take care of those, our joints and our bones, then they'll deteriorate. And so these orthopedic procedures are something that I think will continue to be a rising incidence with a rising population, and we've got to find ways to treat that through population health in addition to the acute surgical episode.
What pushback do you get from employees? If they call in, they scan the QR code, they call in, I'm going to have a rhizotomy, I'm going to have something done or sort of a surgery. What questions do you get from the employees, and what kind of pushback, or what do you hear?
Usually, I think employees' first concern is that an employer is constraining access. And so being able to address that in terms of talking about quality and providing multiple touch points within given markets, I think is important for patients to know I'm not being pigeonholed to see a specific provider, that I still have choice within a realm. And then the other part of that is the carrot, the incentives to go down that pathway as well are really important.
Yeah, I think we hear this a lot of the constraining access, and we tell the employee, we're not constraining the access. We always say, this is America, you have a choice. Yeah. You can go this path and save a bunch of money and get a higher quality care that we know is high quality. Or you go this path, pay more. And they look, well, and it's funny to see where they say, well, I'm looking at my Blue Cross network and this doctor has 4 stars. Where do those stars come from? They're people just, if you got 4 stars out of 20 people that left a review that he was really nice. Let's look at a true quality of care on outcomes and malpractice and how does he do at that surgery? He might be really good at knee surgery, but really bad at spinal.
Yeah.
And looking at that qualities.
Yeah, I think in America, we still have a long way to go when it comes to transparency and consumerism, really understanding what quality is. And so today, I believe our consumers anchor on marketing, overall marketing, but don't have great access to easy to understand data. And that's something that we continue to strive to put out, not only for our customers, but for patients as well, to understand what is the quality of those surgeons. And that's ultimately how we should be picking our patients, is through value and quality, or picking our surgeons, sorry.
No, I love that. I think that's exactly, value and quality. It's where it needs to go. So let's switch gears a little bit and talk a little about the company, because I know your wife works for you. I think she's COO.
Yes.
You mentioned something earlier about her and your chief medical officer. They're doing some podcasts and speaking on some stuff right now. Talk a little bit about that.
Sure. So I think they're really approaching the No Surprises Act and trying to educate the market as to what is fair and reasonable. So this is a concept that is continued to come up in our organization. One of our first service lines was traditionally all out of network. And while we endeavored to get in network, the insurance companies really had no interest in allowing us in network. So it really started this pathway of understanding what is fair and reasonable, and how do we ensure that on cases? Because a lot of times we find that the insurance company will pay us way too much on one claim and way too little on the next claim, and we have to average those things together to figure out what our sustainable payment is. But we're not paying the sustainable payment. We're paying too much in certain situations, riding on the backs of large employers, and then we're paying too little in other situations, which isn't sustainable for healthcare. So how do we hone in on reasonable rates? And I think that has ended up creating the foundation for how we price out our prospective bundles. That concept ingrained into how does that span all of healthcare, regardless of what an insurance company says a payment should be. What is the fair amount for that payment? Not too much and not too little, I think, is where that shakes out. Ala has spent a lot of time focusing in that area, trying to educate and making sure providers understand. Ultimately, this becomes an access to care issue. And if providers are not able to receive sustainable payments that cover their cost of overhead, then we lose that access to care. And the pricing actually gets ratcheted up because these providers get bought out by large systems and other folks that are able to negotiate premium dollars for care.
I know I have a vaccination company, and we do flu shots for corporations and things like that. And it's always interesting what you said. We would watch, especially with insurance and networks, Aetna's given us a $30 reimbursement for a flu shot, and Cigna's given us $120. And it was always that balance in middle. Can we get to that middle ground, which was always seemed to be like Blue Cross. They were 60 to 80, but it was seeing that difference in the reimbursement for the same procedure.
Yeah.
Did you get any, so for doctors and physicians and so on, that providers that were maybe getting a little bit more of a reimbursement versus the lower ones? Lower ones are going to say, yeah, I'll take a little bit more money.
Sure.
But did they push back saying, hey, we still want to get that higher level?
Yeah, I think there's always a push for physicians to try and maximize their collection on a given claim. What we've tried to do is create a methodology that there is a consistent payment more so than a maximized payment. How do we drive healthcare to, whether you're in or out of network, to a transparent methodology for what a fair price is for that service? And that's ultimately, I think, what all of us are after as consumers. It's what I'm looking for in order to price my own orthopedic surgeries. What is a fair price for each of these different components? And then how do you assemble those? I think that's assembling those bundles for the average consumer is not an easy task. So that's where we come in. We've been able to parlay our relationships and the downstream care providers using data to integrate with groups. We're able to see all of those different care pathways and those care partners, and then to dissect quality out of that to make sure that we're referring to the right partners, but that we understand what that cost profile looks like as well.
I think the bundling is so important because we hear it all the time. Somebody has a surgery, they said, okay, well, here's a facility fee, surgeon fee, physician fee. I've got the anesthesiologist, and these bills keep coming in. You think you're all done and you get more bills. And when you can say, hey, it is $15,000 all in, everything's bundled into this package, it makes it very easy for the employee, the employer, and it's a very simple process. So I really like that you're doing that because it does simplify everything.
And we've been able to dissect that for spine. And, I think even at a payer level, CMS performed a BPCI, which was a type of bundle, but it ended up being a race to the bottom for providers because they were competing against themselves year over year over year. And you can only whittle so much off of the bone by year 3 and year 4 when you're competing against yourself. We really try and set our providers up for success by having them compete against the marketplace. We talk about savings through our group versus the pricing that you would achieve in the exact same market. So that encourages physicians that are in the network to stay there, because the more volume that comes to them, the more that average shifts down, but it's not a competition against themselves. And as long as they create a value differential versus a large health system in their given marketplace, employers are continued to steer more and more work that direction.
I love this. I mean, this is giving us all the things we're looking for, the high quality care, that full care management package all the way along the process. And then we're getting that price control and transparency, and I think it's fantastic. How do employers or benefit consultants, et cetera, get a hold of you guys to start looking at implementing this into their self-funded health plan?
Sure. I think there's a few ways. I can be reached at scott.laroque at empowerhealth.com. I think our website, empowerhealth.com, has quite a few resources when it comes to benefits brokers, TPAs. We have a landing page for patients as well. We have a pricing module that is available so that you can go and look up pricing for different surgeries on our website. So if you have a question about whether one of your employees is having a procedure and whether that amount is reasonable, we can do second opinions on those patients as well and send those through the network. So a myriad of ways to get a hold of us, and I think we've got a team ready to respond.
Well, no, you guys, Jessica showed me, you got great marketing materials that really outline everything that you have or allay it all. So, I appreciate you coming in. This is fantastic. I know for a fact, MSK is a huge cost, and usually it's an ongoing repetitive cost within a health plan. So when you start getting a good care management around that, exactly what Empower is doing, highly recommend you guys looking into it. If you're one of our clients, we'll be bringing this to you as well. But I want to thank Scott for coming in. This has been awesome having you here. And now we'll close out. Thank you, everybody. And let's hear a few words from our sponsors and supporters. Thank you. Thank you to our sponsors and supporters. 33 Inc., helping your brand grow with custom screen printing, embroidery, and merchandising solutions. Smart Business Concepts, providing financial services to drive profitability, scalability, and flexibility of your company. And Texas CEO Magazine, informing and educating business leaders across Texas since 2010.
As business leaders, we all know that healthcare is expensive. In fact, it's one of the top 5 expenses in most companies. The decisions you make or don't make in your healthcare plan can have financial repercussions down the road. But not all is lost. There are ways to take charge and get your employees the best possible care, all while reducing overall costs for us as employers and employees too. Get your copy of Life and Death Decisions in the C-Suite, where Dan Labroad and his colleagues pull back the curtain and address how the private healthcare system and health insurance industry have plagued businesses for decades. What you'll discover will empower you to take back control over your health insurance costs that could mean massive savings for your company while giving your employees better quality healthcare. Get your free copy now at the link below or using the QR code provided.